Welcome back, future orthodontist. Today we talk about spacing, when teeth have too much room in the arch. Spacing, also called diastema, can occur in both primary and permanent dentition. Remember the mnemonic DEF, diastema, excess space, found in dentition. Common causes of spacing include tooth size arch length discrepancy, missing teeth or hypodontia, habits like tongue thrusting or thumb sucking, labial frenum attachment, and developmental fractures. Use the mnemonic SMHLD, size, missing teeth, habits, labial frenum, development. Identifying the cause is crucial for treatment planning. Spacing matters for several reasons. Aesthetics, function, and orthodontic planning are all affected. Use the mnemonic AFO, aesthetics, function, orthodontics. Gaps may affect the smile, occlusion, or phonetics, and influence treatment decisions. Management depends on age, cause, and dentition stage. Observation is sometimes sufficient, as spaces may close spontaneously in mixed dentition. Space closure can be done with braces or aligners. Frenectomy may be needed if the labial frenum is involved. Prosthetic replacement is used if teeth are missing. Remember the mnemonic OCFP, observe, close, frenectomy, prosthetic. Always tailor the approach to the patient's needs. To summarize, spacing essentials are definition DEF, diastema, excess space, found in dentition. Causes SMHLD, size, missing teeth, habits, labial frenum, development, clinical significance, AFO, aesthetics, function, orthodontics. Management, OCFP, observe, close, frenectomy, prosthetic. Quiz time. Question 1, what does DEF stand for? Question 2, which is not a common cause of spacing? Question 3, why is spacing clinically significant? Question 4, which is part of management strategies? Great job! You now understand spacing, its causes, importance, and management. Next video, distal movement of buccal segments.